right, today I'm going to talk about a few reflections on long-term laminitis cases. I have about almost 2 years of recorded data on that mare. This is a quarter horse mare who was a little bit obese. I mean, not a little bit obese, she got too fat and then had a laminitic episode, but she's not metabolic. She has Horseshoes, so she's under veterinary supervision. She was always under veterinary supervision. She was sent to me by the vet. So she's taking extremely good care, very good owner. So she has a perfect home, perfect outcome. So she's recovered. So that's when I first saw her. She was fat and, she lost weight, and also the stance changed a lot. At the beginning, I shot her in the front and the back. Now, since she's also retired, she's 16 years old or 14, I forgot. She basically live a very leisurely life in a very well taken care environment. So you can see when I first saw her, the feet were very upright. The foot is not standing under the bony column. As of April of 2026, you can see a much better stance, and the foot is standing under the bony column. The point I'm also trying to make here is that you will have issue that has nothing to do with laminitis. This sheared hoof you see in July 2024 is not due to the laminitic episode. It's just due to someone that's not understanding where to place the shoe correctly. So you can see there's a significant change between the July 2024 to April 2026. This is the left front, and that also will affect also the healing on the foot. Because when you have already pre-existing capsular distortion, you're dealing with the laminitis and the capsular distortion. And I would also advise everyone to be extremely careful with reducing toe lengths, because when you have a sheared hoof, part of the capsule is extremely close to the pedal bone on the dorsal wall, and you can't just go and start reducing quote laminate wedge just randomly. So you have to be really aware of the shearing and other distortion that exist or were pre-existing before the laminitic case. So when I started, you can see the foot is not standing under the bony column. Yes, there is a rotation, but there's also a problem that the horse stance is not correct. So when you have already very high heel with a foot that is also not quite where it's supposed to be, you're going to have problem. And you can see the difference between July 2024 to April 2026. The foot is standing under the bony column, and it's a better stance. So the pedal bone was already compromised in July of 2024. It probably became a little bit more compromised, but not significantly. It's hard to tell, if it's a result of ongoing chronic laminitis, or it just happened as a first time of the onslaught, and it takes a few months to recover from having issue with the pedal bone. But it lost also vertical depth. This is our palmar curve, and on July 2024, the foot is already kind of not as cuppy or has not as much vertical depth, and you can see a comparison from a 12-year-old horse and among 266 horses of mixed breed. It's very normal for horses to lose vertical depth over time, but she's kind of a little bit below the curve. And, again, it's got a little bit less vertical depth, but not significantly. It's still below normal, but she was below normal before, so it's not so surprising, all right? So we're still okay. When I first saw the horse, it had a very drop sole, so that's not good, and that had to be taken care of. And then you can see now from July 2024 to April 2026, we have a much better stance. The foot is not sheared. It's normal for a foot to be a little bit less wide on the medial side than the lateral side, and it's not turned in as it was when I first saw the horse. So I had to do two things: reduce the distortion in the capsule and the shearing, as much also as bringing the stance of the hoof more under the bony column while reducing the increased palmar angle due to the rotation. So tissue have to heal, and it takes a while because, as I say, we are also dealing with other problem that started before the laminitis case. This is new growth. You can buff that, but I wanted to show that actually is a new foot and this is the old growth. This is about to grow out completely, so I'm pretty happy with that. The horse is going to wear shoes, so we did a trim now, and then we're going to help the stance with the support and the shoe and set the shoe back. But you can tell it takes a while for the foot to rebalance itself, and we had also another problem that the foot was not under the bony column. See, the foot was also sheared, so we had also distortion in the wall besides the laminitis.